Hi everyone. I figured it was time for an update. My name is Michelle and I share information on this channel about my adventures with stage 3 triple negative breast cancer, as well as central adrenal insufficiency, which was a side effect of immunotherapy for me, and just lifestyle, clean living, or my quest to find toxin-free living, and carnivore, ketovore diet, and spirituality, anything I find interesting. So join me for this video, and if you like this information, please share or subscribe, or at least give us a thumbs up. I am very new to the YouTube space, but I feel like I'm getting a lot of feedback that a lot of people find this helpful, so hopefully you will too. So here's an update for you. I've just been really busy. There's nothing exciting that has happened since my last video when I discontinued the oral chemo and now, but I have had a lot of people asking questions. People have asked me in the support groups and stuff kind of what happens after, like what happens next? What are the things that you're doing now after treatment's all over? And so I figured, and the other thing was new people that join the support groups ask a lot about what is the timing of everything. And so I wanted to give just a summary video, because I know as I've gone through this journey and posted things along the way, you could go back and watch all of the previous videos and kind of find out, well, what was happening when and what the plans were. But I know that within those, there would be a summary of everything that had happened so far. But I wanted to give one kind of concise summary video of the breast cancer experience. And so, you know, if you're just starting this journey with breast cancer and you're wondering like, okay, well, I'm supposed to be on this treatment plan. How long is this going to take? When can I plan a vacation? Will I be able to take a vacation that's already planned, and that kind of stuff. So I figured I would give one video here where this is the timeline of breast cancer treatment. And so I wanted to just start with when I found my cancer. So I found a lump on a self-exam, and I found my lump on June 27th, 2023. And I went to my doctor, my OBGYN, and she agreed. It was suspicious. She sent me for a diagnostic mammogram, which is a mammogram and an ultrasound, which then triggered a biopsy the following week. And I got my diagnosis on July 18th, 2023. So a little bit shy of a month later, 3 weeks later or so, I got the diagnosis. And a little bit shy of a month after that is when I started treatment. And again, the diagnostic procedures continued within that first month. I got my diagnosis on July 18th. I had a PET scan, an MRI. So there were several other things that needed to happen. And then the MRI sparked an additional biopsy because the MRI found a tumor that nothing else saw that was kind of behind the main tumor. So I was diagnosed in July, again, July 18th, 2023, with stage 3, grade 3, triple negative breast cancer. And so what that means is that it was grade 3 has to do with the size of the tumors. The stage 3 means that it was in my lymph nodes. So I had 2 positive lymph nodes plus a main tumor and an additional tumor in my breast. The main tumor was invasive ductal carcinoma. That's the one that spread to the lymph nodes. And the second tumor was ductal carcinoma in situ, which is DCIS is what they call it. So it was a self-contained tumor, the second one. And as far as the triple negative part, that means that it was not responsive to any hormones. So it didn't have any hormone receptors on it. And so the way that broke down on my pathology report was ER negative, it was less than 1%. PR negative, so that's estrogen and progesterone, less than 1%. And HER2 is another hormone, negative at 0. So there was absolutely no activity with the hormones. So my cancer was not hormone sensitive, so that means it's triple negative. And then a lot of people have asked about this in the support groups as well, but one of the markers that they put is the rate that it reproduces. And so the Ki-67 index is one of those things that everybody wants to know everybody else's number, and it kind of gives an idea of how aggressive the cancer is. Anything over 14% is considered high. Mine was 90. So I was a highly aggressive triple negative invasive ductal carcinoma, stage 3. So that was my initial diagnosis. After that, again, we started treatment a little less than a month later. August 15th of 2023 was my first IV chemo infusion. I did the Keynote 522 protocol, which was paclitaxel and carboplatin for once a week for 12 weeks. And then we switched the chemos to adriamycin or doxorubicin, which they also called the Red Devil, adriamycin and Cytoxan every other week for 8 weeks. So that was 4 treatments total of that. So 12 plus 4. And during that whole time, and the plan was for an entire year, would be Keytruda or pembrolizumab immunotherapy. Now the Keytruda for me, I had 5. It was every 3 weeks it was supposed to be. I had 5 infusions, and then the 5th one is when it shut down my adrenal function. And so that is when I decided to not continue the Keytruda. So just as a side note, I did do the first 5, but after that I did not. But as far as the IV chemo treatments, August 15th was my first. December 26th, 2023 was my last IV chemo. And so this is my hair growth since then, because it did start growing back after that. So 15 months of hair growth. I have not cut it at all. This is hair growth for 15 months. So that's an update for you. So that was about a month later, I had surgery number 1, which was the surgery on the cancer. And so I had a partial mastectomy and lymph node removal, axillary dissection of the lymph nodes on January 30th, 2024. After I healed from that, my first radiation was March 25th, 2024. So about 2 months later. And my last radiation, I had 30 radiations every day for 5 days a week. My last one was May 7th, 2024. Now then, going through the pathology for my surgery, I did not achieve PCR or a pathologic complete response. And I'm going to talk about my pathology report kind of after, but I want to finish the timeline first. So the recommendation, because I did not achieve PCR, was to start oral chemo and to restart the Keytruda, which I declined to do. But I did agree to start oral chemo, which was Xeloda, or capecitabine is the generic name. And we started, the dosage doesn't matter. We started at, it was 1,500 milligrams twice a day, so 3,000 milligrams a day. And then I tried reducing the dose, and I tried changing the schedule. So it was supposed to be 2 weeks on, 1 week off. And we tried going to 1 week on, 1 week off. I had a lot of side effects. And I think probably due to the fact that I have the adrenal insufficiency and my body's ability to deal with that, but kind of the stress of that was diminished. And so I ended up discontinuing after 3.5 cycles, but it was supposed to be 8 cycles. But I had the first oral chemo on May 27th. So 20 days after radiation, I was doing well. I had healed from radiation, so we started the oral chemo. And I discontinued oral chemo again after 3.5 cycles, but it took about 5 months. So October 9th, 2024 was when I decided that I was done. And again, the adrenal insufficiency, I think, is a complication that makes it more difficult for my body to deal with the stressors of that. And so I just had a lot of side effects that just would accumulate, and they'd be different every time, but there were some that were consistent. And one of them was a really negative attitude. And it seemed to be really bad when I was taking that med. And so I decided it was affecting my quality of life. And then in reading the pathology report, I decided, and my oncologist concurred, that it was probably we have to look at the quality of life. It's affecting your life. It's giving you these, it's kind of weighing you down and holding you back from moving on and just getting healthier. And so we decided to discontinue. And so that was 6 months ago. So we're in April now, right at the beginning of April. We're just past April 9th, which would have been 6 months since any kind of cancer treatment. And so what am I doing now? I am still dealing with the adrenal insufficiency. I do have to kind of navigate that world a little bit, which I have other videos on here kind of talking about that. And I'm going to make another one soon anyway, because it's Adrenal Disease Awareness Month, April. So I'm going to make a video in the next week or so on that. So I'm still dealing with that. I had my second surgery. So the first surgery was the partial mastectomy on the cancer side. And then I had a symmetry surgery, or breast reduction, on the other side. I also had a biopsy because I found a lump on that side after surgery, which ended up being just kind of some necrosis of the scar tissue after surgery. It was benign. There was nothing to worry about, but we have a really low threshold of, wait and see. Now that I have had cancer, as soon as there was a lump there that not only I, but the doctor could palpate, then they sent for a biopsy. And that was negative. I'm still in physical therapy for lymphedema and cording in that cancer arm. And so, I don't know, it's not that bad today, but you can sort of see like the definition in this hand is, it's kind of puffy, and it's just, that's all fluid in there. That's what lymphedema looks like. So I'm still in physical therapy for that. And I am, as far as tracking, like if the cancer comes back, my oncologist does not recommend or really utilize any of the blood tests that are out there to see, like to kind of check for cancer activity. He said that there's a lot of false negatives, and he thinks that they cause more anxiety than anything in people, because it doesn't really give us a course of action. If the tests were to come back, positive, there's not anything to do unless we know where the cancer is. And so it's more a wait and see. As far as if I have any symptoms of anything, they thoroughly check that. But there's no kind of ongoing blood tests. What they do check is I have a mammogram and ultrasound, and then 6 months later an MRI, and then 6 months later a mammogram and ultrasound, and 6 months later an MRI for at least 5 years. And I see the medical oncologist every 3 months. I see the surgical oncologist every 6 months. I see the radiation oncologist every 6 months. And of course, still my cardiologist and endocrinologist. I think I'm on like a 6-month rotation with them as well. So that's kind of my follow-up. I am seeing my naturopath monthly still, as I have, sometimes more frequently through this entire process. And we're really just focusing now on healing my body, building up the strength in my body, dealing with the side effects from the steroids that I have to take for the adrenal insufficiency. And, kind of, we're moving in the right direction. It's a lot slower than I wish it could be. I feel that diet is a big component, and I've certainly been off of the carnivore wagon for a while, but, slowly kind of making sure that I am making cleaner choices with my meals, and then, more meat-centric, animal-based, I would say, is my diet right now. Not, kind of staying away from things that I know are inflammatory. But I need to kind of really go back to strict to feel my best. And I know that in my head, but it has been difficult to do that for sure. Now that I've got that kind of sugar addiction kind of in the back of my head, and, so many months of just eat whatever you want kind of took its toll, and I've got to get back the motivation to just stick to it again. And I know that I will. And so I know that I'll feel a lot better as soon as I really can flip that switch and stick to it for more than a few days at a time. So pathology is another thing that everybody kind of asks about. And so this was my timeline for cancer, and that was based on my pathology. And so the pathology report from my initial surgery talks about the tumors. So the 2 tumors that were in the breast itself, the first one, the main tumor, that was the invasive ductal carcinoma, had on pathology no residual ductal carcinoma. So there was no cancer left in that tumor, which means, the chemo did its job, right? It shrunk that tumor. The tumor was identifiable by the cell wall, but there was no cancer in that tumor, but there was lymphovascular invasion. So they could still see that it had metastasized from there. But again, there was no residual cancer in that sample, and it was a clean margin greater than 0.2 of a centimeter. The second tumor that was behind the first tumor, that was the ductal carcinoma in situ, that was still present, and it was 4 centimeters, and it was still, they were still calling it 4 centimeters grade 3, which was the same thing they called it in the initial pathology, but they said with a focal necrosis, and they said there was 1 foci. So there was some death of that cell, but it was still present. And then it said again, all margins were clear. And then the lymph nodes. So the 2 sentinel lymph nodes, the first 2 lymph nodes, right off the breast, they took those out. Those were the 2 that had initially biopsied as positive. And they contained at surgery after chemo, they did contain residual tumor cells. And so because of that, that is why I did not achieve pathological complete response. So the 2 sentinel nodes had isolated tumor cells less than 0.2 of a centimeter each. The axillary, so because of that, because they checked that while I was still in the operating room, because those 2 sentinel nodes still had cancer, then they did the axillary dissection, meaning they took the next kind of the web of lymph nodes that were adjacent to that as they all came out together. And then they took, as the surgeon explained it to me, the next sentinel node. So the first lymph node in the next section of lymph nodes in the armpit, and tested that. And so that went off to pathology after surgery, and we didn't get that report until later. But the axillary, the group of lymph nodes that they took out, which I think were 7, 8, 9, were 7, must have been 7, no, 8, no, 6 lymph nodes altogether, were all negative. All of those were clear. That entire mass was clear. But the next sentinel node did have what they call a micrometastases, which was 0.2, so 0.2 to 2.0 millimeters of cancer. They did not identify that cancer. They just called it a micrometastases. So again, out of the 9 total lymph nodes that came out of my armpit area, 3 of them were positive for some type of cancer activity. And because of that, they don't consider it a pathologic complete response. However, they were isolated cells. And so the other big question that everybody asks is they called it a probable definite response to chemo, because everything did shrink, but it was still there. The residual cancer burden is the other question that everybody asks about. And so my residual cancer burden class, or RCB, is 0. So that is, it's almost PCR, but it's not PCR. They can't call it PCR because there were these isolated cells in 3 out of 9 lymph nodes. But it's really, really close. And those lymph nodes, they took those out. And so I am now considered to have no evidence of disease because those aren't in me anymore. And after that, of course, we did radiation and we did some oral chemo. And so, it's all a positive outlook. It's just, it's those are the little intricacies of this cancer journey. And if you're dealing with the same thing, I'd love to hear from you and know, like, what was your RCB? If you achieved PCR, I want to hear from you too. I think that's wonderful, and I want to congratulate you on that. And if you didn't achieve PCR, like, you can't dwell on that. You have to say, okay, well, what do I do next? What is my next step? Where do I go from here? And so, again, from here, I'm dealing with my naturopath. I'm taking steps to eliminate toxins from my life that we think could have, potentially contributed to this kind of spontaneous mutation of my cells. I do not have any genetic components that would make me susceptible to breast cancer, although I have had breast cancer in my family. My grandmother died of breast cancer, but I do not have the genes. So I'm BRCA1 and BRCA2 negative. Actually, they did a full genetic panel, which I talked about in one of my very early videos about my diagnosis. I did not have any genetic component that would lead to a genetic cause for this cancer. They're saying it was a spontaneous mutation. So I'm really focusing on trying to eliminate toxins. I've eliminated things like a lot of chemicals or fragrances or food dyes, fragrances and even skincare products, which now I've become super sensitive to. I can't use the laundry detergent I used to use because of probably fragrances or maybe some harsh chemicals. So really looking for natural alternatives to all of those things, natural soaps and deodorants. I can't tolerate deodorant in my armpit anymore, or antiperspirant. I had already kind of started to shift to looking for more natural products for those things even before cancer, but certainly now that's just become more paramount. Teflon, like my nonstick cookware, has not been used. I have one ceramic nonstick pan just so that I have something lightweight to use, but generally I'll cook my steaks and stuff in a cast iron pan. So those are the types of things that I can control. And so I'm trying to just kind of navigate and wade through that process. Always kind of reminding myself that I need to I can't change everything all at once. So yeah, I hope to make some more videos about stuff like that. And, I keeping up on my supplements. I am currently focusing on amino acids and kind of rebuilding my system. I do take my vitamin C, D3 and K2, methylfolate, a multivitamin, zinc. I take an organ complex because I don't like the taste of organ meat, and a glandular supplement, digestive enzymes, iodine. I am not taking any hormone replacement at this time, but I am using pregnenolone drops from my naturopath, and those seem to really help with the menopause symptoms because chemo did put me into menopause like immediately. But then other things I take, an omega, a borage oil, L-glutamine is something I take if I'm having an upset stomach because it does really soothe the lining of my intestines, but I don't take it every day. And then L-lysine, alpha-lipoic acid, berberine, tyrosine, DHEA, which I no longer make as part of the adrenal insufficiency. My pituitary does not release ACTH, and that is also something that stimulates DHEA, not just cortisol. Glutathione, NAC, boron, and chromium. So those are the supplements that I'm on right now. Again, that's all under the supervision of a naturopath who modifies those kind of as we go. Do castor oil packs and a kind of a detox mask and detox bath that I previously talked about, and modified citrus pectin. If I remember it once in a while, I will also have that for kind of a liver detox that is kind of just helping my body recover from the poison, essentially. So that's where I'm at right now. I recorded this video 2 days ago and decided it was way too long at 35 minutes. So I shaved 10 minutes off by re-recording it. And I think this is a little more concise, and I followed my notes a little bit more. Oh, and electrolytes, of course. I take electrolytes every single day, at least one packet of Element. I particularly like the raw unflavored Element, and that's the one that didn't come out of the package that I just picked up here. So I like this one, the raw unflavored. It makes my water taste a little salty. I like it. I like the taste of the salt water at this point. So this is my favorite, and there's only sodium, potassium, and magnesium in this. If you if you find you have trouble staying hydrated, or you wanted to try an electrolyte, you can, there's a code in the description. That's my Salty Status code. I am not an affiliate with them at this point. I don't make any money. Every once in a while I get a free box if somebody orders something or signs up for their subscription, but I do have that code. So if you wanted to get a free sample pack, you can click that code in my video description, and any purchase, and you will get a free sample pack with all of their flavors so that you can try them and see what you like. Again, my favorite is the raw unflavored myself, but if you don't like salty water, then you probably won't like that. My second favorite is the grapefruit salt, and my third favorite is the watermelon salt, and my fourth favorite would be the orange salt. The citrus is kind of like a yellow Gatorade, but a little different than that. There's a chocolate salt, which a lot of people like to put that in like coffee. And there's mango chili, which is a little spicy. I do not understand drinking something spicy. I don't like it myself, but I have heard that a lot of people use it like for seasoning. Like you can season chicken with it and then grill the chicken, and it's really good. And I haven't tried that yet, but something to try. So Element, again, I don't make any money off of that, but I just really love them, and I love the company. And if you want to try it, go ahead and click the link. All right, see you next time. I will probably post just the section or make a new video on just the pathology report, so I have a separate video for that. I'm going to make a video on adrenal insufficiency and kind of navigating stressful things in life for National Adrenal Disease Awareness Month. But other than that, I will see you soon. Thanks. Bye.